LSU HCSD routinely disseminates information through an application we call our drilling platform system. The drilling platform will use data from our individual partners' data warehouses. Each of your sites or hospitals will only have access to your data. You will be able to see aggregate data, which is combined for all of the individual partners. This will allow your site or hospital to compare your measurement results to the aggregate value for all sites. Now, for an overview of the drilling platform system. There are 4 platforms to choose from: the program-related platform, PQRS, HEDIS, and directional drilling platforms. We will illustrate the use of the drilling platform application with our program-related platform. The program-related platform provides a way to examine measurement results at your site level, and within your site at your clinic levels, and within your clinics, your clinician levels. This platform is organized around chronic disease and population health areas such as asthma, cancer, diabetes, heart failure, HIV, and medical home. Each topic has its own set of measures. If you click on the indicator drop-down box for diabetes, you will see there are 45 available diabetes-related measures. Highlighting any particular measure brings up a more detailed definition of the measure, such as the fraction of diabetes patients whose most recent blood pressure reading was below 140/90. You will see the long definition in the box below. Every indicator has a default denominator, or patient subgroup. The most basic summary is a graph of the site's value for the measure over time compared to the aggregate value for all sites. In this case, the request generates a graph showing the value of the measure by quarter over the past 4.5 years. The first line of the title states the disease area and the indicator selected. The second line specifies the denominator. By default, this measure is summarized for the medical home sustained clinic group, meaning patients who had medical home visits within the past 6 months and a history of clinic visits extending back at least 12 months. Along the x-axis at the bottom of the graph is the timeline by quarter from January 2009 through June 2013. Along the y-axis on the left side of the graph is the relative scale of the indicator values. These numbers will change depending on the resulting values. The site's values over time are shown by the solid line and the aggregate values by the dashed line. The numbers at the end of each graph series are the numbers of patients as of the most recent quarter. 1,355 for the site and 13,547 across all sites. The 2 horizontal lines are the 25th and 75th percentiles. You can drill down to look at the clinic results within a hospital over time. This is done by selecting one site's clinics over time option in the request drop-down box. We will keep the disease area as diabetes and the blood pressure indicator and denominator the same as the example we just looked at for the site. This graph shows results for each clinic across quarters. It also shows results for the site as a whole and for the system. You can drill even further down and look at results at the clinician level. This is done by selecting Compare Providers within a clinic option in the Request drop-down box. Physician level results can be combined for 1 or more quarters. For this example, we will combine 3 quarters for the new clinic. The physician numbers are graphed along the x-axis. The numbers have been assigned randomly for de-identification purposes. 3 physicians treated patients in this clinic for these quarters. Physician number 05509 treated 428 patients in the new clinic from the 4th quarter of 2012 through the 2nd quarter of 2013. 76% of these patients with diabetes' most recent blood pressure reading was below 140/90. The upper and lower bounds represent the 95% confidence interval. The graph also shows results for the entire clinic, the entire site, and all sites aggregated.